This is a tipping the teapot exercise specific to breathing. We're going to place one hand on the side with the thumb down, opposite hand on the belly, and starting in a seated position is usually a good place to start. Sitting in a chair is okay, but if you're early on learning this exercise, sitting on the floor is even better because it's going to put more of your muscles on a little bit of a stretch. So one hand here, one hand here. We're going to tip forward like a teapot toward the opposite knee. And I'm tipping forward kind of on a diagonal, so I'm not going straight forward, not straight to the side, kind of on the diagonal. And as you do this, I'll face this way so you can see what my spine is doing. As I'm doing this, I am kind of rounding through my low and mid back a little bit, so I'm not just leaning forward, I'm not hinging at the waist, it's more of kind of a tipping and curve to the diagonal. So we have our hands here, one hand on the belly, one hand on the side. You want your pinky of your hand on the back to be just below the ribs, kind of right on the lower part of the ribs. And then you want your thumb to also be just underneath the bottom of your front rib here. So tipping over on the corner, and then you're going to take a deep breath in through the nose. As you inhale, try to expand through this hand here. So we want most of the breath to come from the side of the back here and the back side of the back. So not so much the belly hand, which is why you have one hand here, so that you can monitor and make sure that you're not expanding through the belly too much. So big inhale in through the nose, tipping over. Getting as much movement as you can from this back hand. And then exhale all the way through the lips. Make sure you exhale all the way, all the way, all the way as much as you can. And then repeat that still in a tipped over position. Big inhale through the back hand. And then exhale all the way, all the way. I'm going to demonstrate that one more time. Good. So again, focuses with this breathing exercise are to really inhale, find a lot of movement through this back hand. You really shouldn't find any movement through this hand that's monitoring on the belly. And then when you exhale, try to exhale as much as you can. When you feel like you can't exhale anymore, try to exhale even more if you can. The more you can exhale, it's going to give you more range of motion, more availability through the lungs and the rib cage to expand and make the expansion as big as possible. And then same thing, really exhale so you have the full range of motion available to work through.